I'll tell you that we've been in constant communication with the governor's office, the chancellor's office, and daily meetings with the inter-university council presidents. The key with those meetings was to ensure that we were sharing the messages of what was taking place on our campus, learning from each other, and figuring out what were the best benchmarks for us to do in unison and share the message out to our community. There are some differences between all of our universities that have led us to create things that were slightly off from what others are doing, but there was a necessity behind that. So where are we today? Just as a refresher on what's been sent out, currently there is a complete travel restriction for any university-sanctioned travel for work purposes internationally and now domestically. All events have been canceled that involve greater than 10 individuals being present together in a room. This is per both state mandate as well as the guidelines that are now recommended by the President of the United States. I'll get into the details of how this will affect us in our future a little bit later in this discussion. We've also continued education. As I stated, we're eliminating face-to-face education for now. And when I get to the students, I will talk in more detail about what we're doing in that realm also. And for our faculty and our staff, we've moved to mission-critical personnel only being on campus. This is, again, not to create a sense of panic. As I said, we've had no positive cases of COVID-19 in our population. This is to follow public health rules so that we can continue to prevent a rapid expansion of this virus that would lead to overwhelming our healthcare system and leading to increased morbidity and mortality of our patients in the community. So these are prophylactic measures. Please hunker down, bear with us, and stay within your homes when at all possible if you don't have to be into work or outside in the community. I'd like to get to where we are with our faculty. I want to thank them for continuing to move forward with education, stepping up to this important task that they have as part of their professional careers, and ensuring that we create the workforce for both Ohio and for the nation in the healthcare sector. We are here to support them. They've really rapidly stood up for us to be able to provide educational programs via telenetworks, and I'm very proud of everything that they've been able to achieve. Our staff have been asked not to come into work if they are not noted to be mission critical by their supervisors. Mission critical means mission critical. Not that we would like to have you here, but if we can do without you being here so that you can telecommute in, that is the intent. Now, in order to meet state law, there are some individuals who normally would have to be present to be paid. We've looked at the legal processes around this with the assistance of Maria Scheimer, our attorney at the university, and her team. And we figured out that under FSLA, we can repurpose what it is you do as an employee to still meet that intent. So we're asking those of you who normally would have to be present on campus to do your defined work tasks, that this is an opportunity for you to develop your skills and your careers for the benefit of the university. We will be standing up a lean education program with the assistance of our 2 hired process engineers, Sarah Brickley and Leslie Tabler, who have rapidly put together a curriculum that will be posted online. It will be active, it will be trackable, and the intent is that those of you who are at home and unable to pursue your normal daily work functions will be able to focus on areas to improve what we do as an organization so that those ideas can come back, be somewhat matured by the time you get here, and we can start to implement and recognize the great ideas that you've created during this time where we can be innovative as an organization. I would also ask that you work with your supervisors and find time to get onto our intranet and complete computer-based training that will enhance your skills, enhance your benefit to the university, and also build who you are as a professional. For our students, this is a very difficult time of uncertainty, and we understand the sacrifices that you are making. This really, at the end of the academic year and as it approaches, should be a time of celebration, celebration of graduation, and celebration of advancement into further years as you get through your studies. It's unfortunate, but those sacrifices mean that we have to get away from some of the traditions that have been so important to us, most notably Match Day. By now, all of you know that Match Day has taken place on Friday for our College of Pharmacy graduates going to residency, and we had a very successful match rate. Dr. Kasmer will elaborate on this in future communications. For our College of Medicine students, Match Day will be on Friday. Because of the government bans and looking after the health and safety of our students, faculty, staff, and your families, we will not be able to congregate together in celebration. However, the College of Medicine, under the leadership of Dr. Young, has managed to put together a virtual sharing platform where we can still celebrate and recognize your accomplishments. I've been informed that we've had a very good match process, both from a historic percentage rate as well as matching our students into some of the most competitive residencies that are out there. So congratulations to all of you for that. As I noted, that we will also be reducing other events. This includes, as you know, face-to-face interactions. I'll get to some caveats on that potentially in a moment. I also want to recognize that we've had to really shut down some important events, such as the Sikh holiday that we were going to celebrate about a week or so ago. We've also had to cancel the presidential inauguration, and we are currently hopeful that we will be able to continue on with commencement ceremonies. However, that remains something that we are not certain of and would require the government to lift the ban on congregation of individuals. As hopeful as we are, we also have to prepare for the fact that we may not be able to hold our standard commencement celebrations in the tradition of the university. Under these circumstances, we are currently creating an alternate plan through which we can still recognize your accomplishments and celebrate with you together and your families in an alternate model. But our hope is not to have to go there, and we will communicate with you on a continual basis as to where we're going with that. We've had a great deal of concern from our students and from a great deal of family members reaching out to the university deans and the president's office, asking what we're doing to ensure the safety of our students. And your safety is first and foremost to us. This is the reason we have stopped face-to-face interactions. Some universities have shut down their dormitory housing. We have elected not to do that at this time. Our real reasoning behind this is that the dormitories are not traditional dormitories here. They are isolated full apartments with washer and dryer and full kitchen capabilities, with each student being able to have their own restroom and showering facilities. So this is not that communal concern that we have at the other universities within the state. We see this as a place where you can isolate yourself and keep yourself safe while you continue your studies. The reason for that is our college deans have studied the way our education is delivered, our national requirements, in order to ensure that you progress appropriately. And that means that we have to continue to deliver national-based testing. This is testing that we as a university really don't have control over. We have to maintain the integrity of the tests that are provided to us through our national organization. So they must be carefully adjudicated and carefully monitored during the time of testing. To ensure the wellness and safety of our students, we have brought these in sequentially so that all students aren't coming together at once. We're keeping them very limited into a very large setting so that there's a great deal of social isolation, moving those students out before we bring the next ones in. Now, we are working under a very fluid environment, and this could change at any time. Our current goal is to ensure that you get through your educational requirements safely. And our university has a little bit different task than other universities do. We are creating the healthcare workforce that's going to go out and serve our state and our nation. Our fourth-year students in pharmacy and in medicine will be on the front lines of healthcare delivery across this nation at the busiest medical centers we have in about 14 weeks. We need you prepared. We need to make sure that you graduate on time so that you can provide that level of care and have a comprehensive understanding of personal protective equipment and social isolation in ways that can be practiced to limit your exposure in the clinical setting. This is the same with our pharmacy students who will be out as clinicians, residents, and interns delivering care to our community. We need you prepared and we need you safe. So please work with us and bear with us as we continue to ensure that we get you through this, because in fact, it won't be very long before you take the oath and you place the lives and health of our patients as your foremost concern, and you will be on those front lines as interns and as residents and clinicians. And it is incumbent upon us as a university to make sure that you are fully prepared to deliver that care and to do it in a way that mitigates your risk to keep you safe. For others, we're trying to figure out how to manage fourth-year required curriculums that lead to experiential education in the clinical realm required for education, and we've created some very nuanced ways of being able to do that meet the intent so that we can graduate you and still meet the requirements that are put upon us by the Liaison Committee for Medical Education, our national body that oversees our accreditation and the delivery of degrees to ensure that we're creating a well-educated workforce. I expect there will be more questions following on this, and I ask the students to please be in frequent contact with our university, as our deans will be reaching out to you via communication channels, potentially a phone, but certainly by email, through our website, and potentially through text. Under those circumstances, I need you to be attentive, and please work with and communicate with your parents, your significant others, and your families to put them at ease that we are doing everything within our potential to keep you safe and at the same time educate you to take care of the workforce. This is a difficult time for all of us. I want you to look to what this university has done. The real heroes out there right now are the alumni from this organization. Our alumni are out now giving of themselves, putting themselves at personal risk, taking care of and calming our community as we watch the COVID-19 virus infectious process deliver itself in unravel ways that we hadn't imagined. Our real effort here is to be preventative, to look ahead and be ready for the worst, hoping that those outcomes that come are the least. But you are key. Look at our alumni and the amazing work that they are doing. Standing side by side with them in the very short future will be our fourth years from the College of Pharmacy and the College of Medicine, here to look after the health and welfare of our community. Look at the leaders. I'd love to be able to point out some of the amazing leaders that have come out of the Northeast Ohio Medical University. All of you who have been tracking this on the national and state media have noted Dr. Amy Acton. Dr. Acton is one of our graduates from the College of Medicine. She has been recognized nationally for both her calming leadership and her effective leadership in helping this state become a recognized benchmark in how we manage the COVID-19 crisis. I had the opportunity to speak with Dr. Acton on Saturday night, where she shared that understanding how to do what she does and her beginning started with Neomed. She also shared that when she became aware of Neomed as a child, it became her dream to get into this university, and it's allowed her to launch into an amazing career where she's having truly successful impact here on the lives of our community and now being benchmarked nationally. In that discussion with Dr. Acton, we touched on some very difficult issues. As many of you know, nationally, medical students, pharmacy students are being pulled from the clinical locations in their third and fourth years, mostly out of concern for their safety and out of concern that we might be spreading disease to patients, because those of our students in that age group are likely to be asymptomatic or to have minimal symptoms compared to the elderly in the population. There's also a national shortage of protective equipment. As we address those issues, and we have now separated our students from that clinical environment, the question is, when do we need, or do we need to bring them back into that environment? That discussion led to the issues of what things that are taking place in Italy now, where their healthcare capacity has become overwhelmed. They are turning away patients who are in their 80s and beyond because there's concern that we need to get to patients who have a much more higher likelihood of surviving. This is a triage process that we do not want to be in. And it's quite possible that we will need to have our students step up at some point and become active in the clinical environment at a level beyond their current accreditation and privileging. If we get there, it'll be because we have an absolute crisis that has expanded to a point that we hope we can avoid. But if we do it, we're going to call upon you, we're going to call upon our faculty, we're going to call upon the community to step out in a way that we've not had to do before. We are a healthcare university, and this is a national healthcare crisis. This is our time to lead. This is our time to show what our capabilities are and what our value is to the community of Ohio. So I invite you now to provide questions to me. I would be happy to answer. We're going with questions directly from audio, as I do not have your text questions in front of me. I'm sorry, actually, I'm being told that we will take questions via live chat, and they will be allowed to be read into the studio. So I open it up to you now.
The first question, are plans to roll out the new College of Medicine curriculum fall 2020 going forward despite the disruption caused by COVID-19?
So the question is the new curriculum that's expected to be rolled out in the College of Medicine, this is the first year, in July 2020 going forward. Dr. Young has seen this as a mission critical component for us. We are obligated to get this out, and we're doing it in such a tight time frame that COVID-19 hitting in the middle of this planning was really an escalation of that crisis for us. But this is something that we must do, and we have our team present here, using social isolation to protect themselves, but working together as a team, including using telecommunication in those team meetings. We expect that we are on track and we will have this curriculum ready to roll out in July. And that is only because of the talent and dedication of our faculty and our staff who are helping to lead this. Next question.
Is there an effort to deal with the State Board of Pharmacy to allow students unable to complete rotations to graduate and take their boards?
The question is there an effort with the State Board of Pharmacy for students pending graduation to be able to get through this with their required experiential education? Dr. Casimir gave us a briefing on this today. He feels confident that he's going to be able to handle this situation. He has been in touch with the credentialing bodies, and at this point feels like we have a way forward that will not prevent our students from being able to graduate on time. I expect he'll send out further communication on this directly to our students and faculty in the College of Pharmacy.
Please clarify mission critical employees. What level of hierarchy does that mean?
I've been asked to clarify mission critical employees and what level of hierarchy does this mean. I understand that this was going to be an area where there'd be some confusion when we sent out our communication on Sunday. That communication was not meant to create panic or fear. It was meant to ensure that our staff and our faculty knew not to come in unless they knew they were mission critical. And you would have known that if you needed to be here because your supervisors would address this. The following morning, I asked supervisors to reach out to all of our personnel to ensure they were updated on what their taskings were, to understand whether they wanted to take either paid or unpaid leave or continue to get paid and work from home, and how we would go about monitoring that and following the work product. Mission critical means mission critical. If you do not need to be at the university in order to conduct your work, then we really don't want you here. We want you to be home. And that means be home. So we are going to monitor this. This is work time. You are getting paid. And that's important to us to be able to ensure that you have the ability to feel comfortable in your own financial situations. That is our obligation to you. From you, I need to make sure that you are indeed following the isolation, that you are at home taking care of yourself and your families, for those of you that have families that you're taking care of, not to be out, not to risk either contracting or disseminating, if you don't show any symptoms, the disease, as we try and, as they say, reduce the area under the curve or flatten that curve so that we are not ending up with so many people who are positive and symptomatic that we overwhelm our healthcare system. Your supervisors have been told to define mission critical. That comes from our deans and our vice presidents in discussion with the supervisors who are under their leadership. I hope that answers the question. Our job is to communicate to you so that you know who you are. And I've also asked our senior leadership team here to ensure that we are following that guidance, that it is truly only for people who absolutely need to be on campus. Next question.
What is the impact on the LCME accreditation process?
We don't expect any impact on the LCME accreditation process at this time. We are continuing to move forward with addressing the issues that were identified. I have full confidence in Dr. Young and her team. I was in a meeting with them this morning. They were actively moving forward with solving the issues that we need to address, and we feel confident that we will be there on time. I also know that we've reached out to the LCME and to the AAMC, having them understand that this is a time of crisis and asking them to give us some latitude as we continue to move forward. We hope we don't need that latitude, as we are aggressively moving forward on corrections and expect to be there.
What is the plan for commencement at this time?
Currently, the plan for commencement is evolving. We are hoping that the crisis will be lifted by May 2nd. I say hoping. I can't say that I'm optimistic of it at this point. I am meeting with our commencement team today to discuss what our other options are. Unlike some universities, this is a little bit more complicated for Northeast Ohio Medical University, because our graduates, when they are finished, are going to disperse across the country, although many and most, I believe, will be staying in Ohio. We'll look at the results of our match on Friday, but you're going to be tasked with working, so simply delaying it till the summer really won't work for our graduates, both in the College of Pharmacy and the College of Medicine as a whole. So we will continue to study this problem. I hope to have alternatives created, a plan that is meaningful for allowing the celebration with you and your families for the incredible hard work that you put into your graduation at this point.
An email was sent out referencing a NeoMed quarantine. Can you touch base on that?
I was told that an email was sent out referencing a NeoMed quarantine. I can't say that I'm familiar with a specific quarantine. What we have asked individuals to do is to identify travel into high-risk areas, or for those individuals who are on cruises. This is per the state of Ohio governor's guidance. Those individuals who wrote in were asked to follow CDC guidelines and self-quarantine. We have not mandated any type of quarantine on individuals within our community. We've asked them to look out for the health and welfare of themselves, our team, and our community by strictly abiding by CDC guidelines. That does bring me to a note of concern. While I doubt that this was taking place, and if it was, I'm sure it was very limited, but we've received concerns from our students, our faculty, and our staff that perhaps not every member of the community is following those CDC self-isolation guidelines. I will ask that you please abide by those. I realize that you may feel perfectly well, but the intent isn't necessarily for you. The intent of self-quarantine is to protect those you may expose to a virus that you could have. The majority of you will not either be symptomatic or become significantly ill. It's the at-risk population that we're trying to prevent the transmission of COVID-19 to through these measures.
With all fourth-year medical students still be on track to graduate and meet licensing requirements as well as pharmacy students?
I've been asked if all of our fourth-year medical and pharmacy students will continue to be on track to graduate. The answer to that is yes. We met today, and we've been meeting daily with the leadership team from both of those colleges to ensure that we are on track. And they are meeting and moving forward very diligently. They are here today. They've been here every day trying to ensure that this is taking place. We're reaching out to our clinical partners. We're reaching out to our accreditation bodies, and we will find a way to ensure you get through this. But what I need from you is an understanding that we may need you here. So if you decide to leave the area, there's a chance that that could delay your graduation. And this is because we are bound by strict guidelines on getting our students to graduate through our national licensing bodies. So I ask you, please be in communication and please bear with us regarding that so that we can get you through this. We need our fourth-year students to graduate on time, as this is likely going to continue to be an issue here in the United States for at least the next month, possibly many months, and you are going to be needed to take care of the health and welfare of this state and this nation.
Have any decisions been made at the university level regarding WASN activities, or is that up to the individual colleges?
I've been asked if decisions have been made regarding WASN activities. This is our simulation area for bringing students in and evaluating competencies. At this point, we had said elimination of WASN in our communication. However, I do realize there may be a requirement with our colleges in order to get our fourth-year students through on time to do some one-off simulations. If that is the case, we will ensure extensive cleaning is taking place to ensure terminal cleanliness as we would in a clinical environment. And we will ensure complete isolation of our students so that they are not at risk while we put them through these evaluation measures. Our goal is not to do it unless it's absolutely necessary.
So currently there are no more questions at this time. A comment from Dr. Tim Collins. Well done. Thank you for your leadership. And that's all we have.
Great. We just received a comment from Dr. Tim Collins recognizing the important measures the university has in place. Thank you, Dr. Collins, for that. Please, first and foremost, look after yourself, protect your family and your communities. We are here to ensure that we protect you and get you through your education while doing so in a way that our staff and our faculty are put at minimal risk and our students are put at minimal risk. We will continue to be in intensive communication with you. I realize that nonverbal communication is not ideal. If we receive feedback today that this has been useful for you, I will plan on doing quick daily updates via this media to be able to continue to inform our community. I have a meeting today with the IUC presidents and the chancellor's office. If anything new comes from that meeting, or if there are any new initiatives or restrictions by the state or federal government that affect us as a university, we will get that information out to you immediately. To our faculty, our students, and our staff, thank you for all that you do for us. We are moving forward, and we really appreciate you being behind this university. Thank you very much.